you go home, we'll also send you home with blue clamps. Okay. When you go out anywhere, you always want to make sure that you have supplies ready with you at all times. That means to be ready for a flush, cap change, be ready for a dressing change, and you have your blue clamps with you at all times.
Okay.
All right. We do not recommend you using scissors or anything sharp around to remove the dressing.
Okay.
We've had families that have used scissors to cut the dressing, and they actually accidentally cut the line.
That's not a good
So
thing.
we don't want that. Okay. But if for some reason there should be a leak anywhere in the line, or there's a crack and you can see it leaking, what you want to do is you want to take your blue clamps and clamp above the problem. Okay, so if the problem is here, you want to clamp above. If the problem is here, clamp above. If the problem's, well, you shouldn't really be up here, but wherever the problem is, just clamp above. Okay. Sometimes what happens is that, especially with toddlers, when they move, they like move around, twist and turn.
Yeah.
So this could give way, and it could create like a bubble. The bubble could pop, and there could be a crack in there. So just have your clamps ready. And also, when you close it, you always want to clamp where it says clamp here, which is the thick part of the catheter. If you have it up here, this could also cause wear or tear on the catheter. So just go ahead and move it, and make sure that you only clamp on the thick part.
Okay.
Okay. That was it for that. All right.
Is that blue clamp used during the dressing change? Because I didn't see you doing that.
No,
okay,
this
is
is
just in case measure.
Just in case there's a crack somewhere.
Okay.
It's in the book, so I just wanted to be sure I brought that out. Alrighty. I know the book has it, but the next part is changing the injection cap or changing the cap. Okay. With that, you'll need 2 caps. Because again, whatever we do to one, we do to the other. You will need alcohol for this part, but it's inside the changing change cap kit. I'll show that to you. You'll need 2 heparins. I'm just going to reuse the old ones. But again, the heparin's always blue. Okay. And then we're going to use the Curos at the end, and we're going to use our change cap.
Okay.
Some nurses will show you, they don't like to be wasteful, and by that I mean they might show you how to get away with just using 1 cap change kit. As you do this and you feel more comfortable, if that's something you want to do later on without contaminating it, then that's fine. But I'm going to teach you to do 1 first, and then do the second one with a separate injection kit.
Okay.
And again, everything that you need is in the kit with the exception of the heparin and the cap itself. And again, before I started, I made sure that I washed my hands really good with soap and water. Okay. And to open up you'll see little arrows there. Just go ahead and peel that away. All right. Now the book tells you, and this is a step that we got rid of in the book, but it tells you to clean with alcohol. But this is already clean. I haven't touched anything. If you notice how I grabbed it and peeled it, it's still clean. I haven't touched anything. So we removed that step. And again, you want to go ahead and make sure that you remove the air from the heparin. Okay. You're just going to go ahead and push and turn. There's air in the cap, so we're by doing this, we're removing the air. Okay. And then there's another blue cap at the end. So I'm going to go ahead and pull that away to loosen it up. And then again, until you see a teardrop.
Okay.
The very top. Okay. And then we just want to make sure that we lay this in a nice clean area. If for some reason this falls off, you feel like you touched something, you can't contaminate anything, just throw everything away and restart over again. Okay. And again, in the kit, you'll have a mask. It's already there. And again, she'll be wearing a mask. Anybody in the room that's helping you will also be wearing a mask. And this is a little flimsy mask. Okay. And since she has 2 lumens, you might forget like which one did I do first, because sometimes I forget. So it's a good idea. Just to remember I'm working with the red one, and then I'm gonna do the white one. Otherwise, you do get a little confused. Okay. These are my sterile gloves. And again, we want to be, your home is not a sterile environment. We just want to be as sterile and clean as possible. Obviously, you can't be sterile at home, but in the hospital, there's more bugs than that she's not used to them at home. Okay? And then now we can go ahead and touch everything that's in. Okay. This is a sterile drape. There's everything in here is sterile, and we're going to go ahead and grab the tweezers, and we can actually just get rid of that. We're going to just go ahead and grab the cap just like that and place it over our sterile field just like that. We can go ahead and get rid of the tweezers. We don't need them anymore. And then at this point, we can go ahead and, these are alcohol. Just go ahead and open the packages. Okay. Just like that. Okay. And you can open up all of them. There's a lot in there, but you don't really need all of them. But if you want to, you can open up extras. So at this point, it would be better if I was on the other side but it's okay. I'm not left-handed. So we're just gonna go ahead and, with the gauze, we're gonna just go ahead and grab the Brobiac right here. So technically, I'm still sterile after that. I'm just gonna go ahead and grab alcohol. And we're actually just gonna clean here between the junction of the catheter and the cap. Like I said, I'm not left-handed, but you want to clean it really good for 15 seconds using good friction right in between the junction. Just like that. Really good. We're gonna go ahead and get rid of that. So our garbage. We're gonna let it dry for 15 seconds. I like to get a second one and just kind of clean, and I hold the old one and I just, that's the tricky part, is removing it. So we're gonna go ahead, this is the old cap. Okay. You never want to clean around there with an alcohol. There's particles that might get in there. It can cause an infection. We can't see them. They're really tiny. All right. And then we're just going to go ahead and grab our cap. Just turn and twist and turn. Okay.
And then and this has to be done every day.
No, once a week.
Oh, also 1 week.
And then
so
we're going
to. The dressing we just changed, and now we're changing the cap. So both of them is weekly. The flush is daily. Yeah.
And then you want to just go and make sure that this is open. And you're going to go ahead and push the heparin in. Push, pause.
Yeah.
You can go ahead and clamp. Remove that. We're going to go ahead and, I'm going to save it because I'm using it for teaching purposes. And the last step, as I always mention, is always the Curos. We're just going to go ahead and place the Curos back on. Okay. And then this one's done. And then I'm gonna go ahead and get rid of all my supplies. I'm gonna wash my hands. I'm gonna do the same thing
on the second one. So this is, it's like a sticky, it sticks onto this thing?
You can peel it off.
Okay.
It just peels right off.
Okay, yeah, I see. Okay. And these green things remain on, right?
They do stay on.
Okay.
Yes.
Okay. So this is called what again?
A Curos. C-U-R-O-S.
Curos.
Curos.
Cap is this part right here.
The injection cap.
Injection cap.
And then right here. This is just part of the Brobiac.
And this is the
lumen. We just call it Brobiac lumen.
Okay. And then this is the lumen.
This is the Brobiac, yeah.
Brobiac
or this is the red lumen, we call it. This
is
just the red lumen. This is the white lumen. Hers might be different. There's some that are purple.
Yeah.
There's different colors.
Okay.
And that is what you would do once a week. Or if for some reason the cap came off, loose. Now the trick to this is you don't want it too tight.
Yeah.
Or you don't want it too loose.
Right.
Okay. If it's too tight, then you're gonna have a hard time
split it.
getting crack it, and then you're gonna have a hard time getting it off. If it's too loose, where it's just it could come off after if this is really loose. After a while, it can just come right off. So the trick is just going to be getting it right in the middle somewhere.
So what if I'm like, oh shoot, I cleaned this with alcohol and I wasn't supposed to? What do I do then?
Well, you're supposed to clean I couldn't do it earlier. Right there.
No,
You
like
mean-
what if it was open?
You mean
and
like
then,
this?
And then it was like, oh shoot, I cleaned it with alcohol and I wasn't supposed to. Then,
Well, if she develops a fever, definitely call the oncologist. You can go ahead and call the clinic and ask for them for advice.
Okay.
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 But definitely, if you did that and she developed a fever, you definitely have to bring her in.
okay.
Okay.
Yeah.
Okay. Sounds
With
good.
any fever, you want
Yeah,
to bring her in.
for
but
sure.